It's a usual question for people with a diagnosis of a malignancy to ask what is different about me and all the other patients that I know with this disease, particularly in support groups. Myeloma has a wide spectrum of presentations and of clinical effects, from none whatsoever and not requiring treatment to a very significant illness with many organs affected and sometimes failing. There's a spectrum of this disease from something that looks a lot like a benign tumour. I often describe a polyp in the colon, which if left alone will become malignant but can be removed before it's cancerous. There is a phase in myeloma like that, but unfortunately we have no way of removing it because the organ affected is the bone marrow and is present in a wide variety of places through the bones of the body. At its most benign end is a condition called MGUS, or monoclonal gammopathy of uncertain significance. And in this case, all we see is the abnormal protein produced by the plasma cells in the bone marrow. There's no damage to any organs. Further along, we get further accumulation of these cells, and the bone marrow may start to become affected, but there may be no particular symptom that the patient has. And the patients with this smouldering form of myeloma may not require any treatment at all, but just slightly more close observation. Then we get to symptomatic myeloma, and this is where the action is in terms of requiring treatment, where many symptoms can occur as a result of the bone marrow being involved, the bones being damaged directly, causing pain or fracture, or the protein causing difficulties with the kidneys, or in some cases clotting or bloodstream functioning normally. So the symptoms can be many and varied. It depends on the stage of the disease, it depends on the type of protein that's being produced, and also depends on what other illnesses patients with myeloma may have. We always have to remember that patients with myeloma are generally in the older spectrum for patients with blood malignancies, blood cancers, and generally older than the age of 60, although by no means confined to this age group. So what we call medically comorbidities, that is other conditions which coexist with the blood cancer, are very important in determining what symptoms patients might experience.